For the primary outcome, which is what the trial was powered for, was the radiographic progression-free survival. The study met its primary endpoint, demonstrating a significant improvement, almost doubling of radiographic progression-free survival in the primary cohort, which is cohort A. And also what we're reporting now at ESMO with my colleague, Dr. Joaquin Mateo, presenting the data, and the paper that was just published today at New England Journal of Medicine, reporting one of the key secondary endpoints, which was overall survival, again demonstrating that in cohort A, olaparib improved median overall survival by about 4.4 months compared to the enzalutamide or abiraterone treated patients. The treatment with olaparib also reduced the risk of death by 31%, which is, I think, a meaningful endpoint. This is not just statistically significant, but considering how heavily pretreated this patient population, this is very much clinically significant with regard to managing these patients. I should point out that the trial design was such that it allowed crossover to the olaparib arm for the patients who were on the control arm. What we've seen, in fact, is despite the crossover in both arms, actually, the patients who were treated with olaparib, randomized to olaparib, had a better overall survival. So I would like to end first by thanking all patients, their families, and the investigators and their teams internationally. Without their support and volunteering, this could have not happened. I want to highlight how much of a landmark is this, because, as I mentioned, up until now, prostate cancer was managed with a one-size-fits-all approach. And I have to highlight the fact that the PROfound trial is the first phase 3 trial to demonstrate, in fact, it's feasible to do targeted therapy trials in pre-selected populations in metastatic castration-resistant prostate cancer, that these trials can be done in a timely manner and deliver, hopefully, meaningful outcomes for patients.